Cardiovascular disease is the leading cause of death in the world and continues to grow at an astonishing rate. Affordable access to care has also become a greater issue in the United States. Nearly 20% of Americans are either uninsured or underinsured. 80% of Americans who have adequate health insurance do have access to specialty care, which includes care from a cardiologist, follow-up care, prescriptions, preventative care, and non-invasive diagnostic testing and treatment options for heart disease. The remaining 20% of Americans do not have access to this recommended level of care. Instead, in order to avoid expenses when serious health issues aren't presented, they do not receive early treatment. When their health issues become more severe, such as a heart attack, they receive care in an emergency room. Emergency room care is extremely costly. An outpatient exam that includes imaging costs about $1,300 to the insured population. In an emergency room, where no patient medical history has been established, the same imaging costs $6,000 and most often leads to a one-night stay in the hospital, which costs about an additional $2,000. Not only are 2 out of 10 Americans missing the opportunity for preventative and non-invasive treatment options, but they are also leaving a heavy unpaid financial burden on our health systems. In 2016, Twin Cities-based hospitals reported $10 to $30 million each in charitable, uncompensated care. What's even more alarming is that this is a 30% increase from 2015. What can each of us do to make a difference? How can we help people from our Twin Cities community receive preventative, high-quality care for cardiovascular disease? How can we take action to prevent financial burden on our health systems and society? A team of local physicians and community members have defined an innovative solution. We will be opening a cardiovascular clinic, Rama Heart Care, for the uninsured and underinsured members of our community. Rama Heart Care is planning to open late summer 2018 in Bandana Square in St. Paul. At Rama Heart Care, we will serve as a referral clinic for uninsured and underinsured patients to provide them with high-quality cardiology consultation and diagnostic services. As advanced testing and non-invasive procedures are identified, Rama Heart Care will partner with neighboring hospitals to coordinate patient care in their outpatient surgery centers. This is truly a community effort, as these are the same hospitals that are receiving the benefit of the reduced financial burden in their emergency rooms. The clinic will be staffed with volunteer cardiologists, physician assistants, and other support roles. Several paid positions are also required to ensure consistent, high-quality care is delivered. We have received generous donations for diagnostic testing equipment, but will need to finance maintenance contracts to keep the echocardiograms, ECGs, and treadmill tests effective, accurate, and compliant. In order to open our doors and grow the number of patients we are able to serve, we are seeking to raise $50,000 in 30 days. Thank you for helping provide cardiovascular care for the uninsured and underinsured members of our Twin Cities community.